Good day, everyone. My name is Rachel Mahinay from BS Entry Lineager, and today I will going to perform the vital signs assessment.
Step number 1, wash your hands. Hand washing prevents the spread of infection.
Step 2. Prepare all required equipment. Organization facilitates accurate skill performance. Step 3. Explain the purpose and procedure to the client. Providing information fosters cooperation and understanding. And step 4. Close the doors and or use a screen. Maintains client's privacy and minimize embarrassment. And step 5, clean the thermometer with rubbing alcohol before first use. Wipe from the area where few organisms are present to the area where more organisms are present to limit spread of infections. Next, assist client to a supine or a sitting position. It is to provide easy access to axilla. And then move clothing away from shoulder and arm to expose axilla for correct thermometer bulb placement. Be sure the client's axilla is dry. If it is moist, pat it dry gently before inserting the thermometer. Next, press the button to turn on the digital thermometer. And then insert the bulb of the thermometer under the arm, fully into the armpit so that it is in contact with skin. Keep the arm flexed across the chest, close to the side of the body. Remain still and wait for the thermometer's beep to signal that it is finished. After the beep, promptly remove the thermometer. Then, wipe the thermometer from the stem to bulb with alcohol. Next, explain the result and instruct him or her if she has fever or hypothermia. Next, wash your hands and lastly, record the client's result. For radial pulse taking procedure, first wash hands. Second, explain the procedure and purpose to the client. And third, assess the client in assuming a supine or sitting position. If sitting, bend client's elbow 90 degrees and support lower arm on chair and an examiner's arm slightly flex the wrist. And then count and examine the pulse. Place the tips of your first index and third finger over the client's brachial artery on the side of the rest of the thumb side. Apply only enough pressure to reach a pulse. Using watch, count the pulse beats for a full minute. And then, record the rate on the client's chart. And lastly, wash your hand. In respiration taking procedure, first step, make the client's position comfortable, preferably sitting or lying with the head of the elevated 45 to 60 degrees. And then prepare count respirations by keeping your fingertips on the client's pulse. Then counting respiration, observe the rise and fall of the client's one inspiration and one expiration chest. Count respiration for 1 full minute. Allow sufficient time to assess respiration, especially when the rate is with an irregular. Next, record the result of the client. Last, perform hand hygiene. In blood pressure taking procedure, first wash your hands. Next, Gather all equipment. Organization facilitates performance of the skill. Cleanse the stethoscope's ear, pieces, and diaphragm with a swipe or spirit swab wipe. Have the client rest at least 5 minutes before measurement. Assist the client to a comfortable position. Be sure room is warm, quiet, and relaxing. Remove any constrictive clothing from your client. And then, center the cuff's bladder approximately 2.5 cm or 1 inch. Palpate the brachial pulse. Center the bladder to ensure even cuff inflation over the brachial artery. And then, wrap the cuff snugly around the client's arm and secure the end approximately. Loose-fitting cuff causes false high readings. Approximate way to wrap is that you can put only 2 fingers between the arm and cuff. For palpatory method, palpate brachial pulse distal to the cuff with fingertips of non-dominant hand. Close the screw clamp on the belt. Inflate the cuff while still checking the pulse with other hand. Observe the point where pulse is no longer palpable. Inflate cuff to pressure 20 to 30 mmHg above point at which pulse disappears. Open the screw clamp, deflate the cuff fully and wait 30 seconds. For auscultation, position the stethoscope's earpiece comfortably in your ears. Turn tips slightly forward. Be sure sounds are clear, not muffled. Place the diaphragm over the client's brachial artery. Proper stethoscope placement ensures optimal sound reception. Do not allow chest place to touch of cuff or clothing. Close the screw clamp on the valve and inflate the cuff to a pressure 30 mmHg above the point where the pulse had disappeared. Open the clamp and allow the aneroid dial to fall at rate of 2 to 3 mmHg per second. Note the point on the dial. When first clear sound is heard, the sound will slowly increase intensity. Continue deflating the cuff and note the point where the sound disappears. Listen for 10 to 20 mmHg after the last sound. Release any remaining air quickly in the cuff and remove it. If you must recheck the reading for any reasons, allow a 1-minute interval before taking blood pressure again. Assist the client a comfortable position. Advise the client of the reading. And then return the instruments to proper place and discard it. Lastly,